Hi everyone, I'm Dr. Pracha Eamranond, Chief Medical Officer at Doctorpedia, and today I'm happy to present Dr. Tom Wallick, faculty member at State University of New York. Tom, welcome to our webcast.
Thanks for having me.
So, Tom, can you start us off by telling us a little bit about yourself and how you got into the role that you're in?
Sure. So I'm a professor or assistant professor of Pediatric Gastroenterology at SUNY Downstate, which is the only academic institution in Brooklyn, which we are very proud of. I completed my residency at Columbia University here in New York, went over to San Francisco for a very long fellowship in pediatric gastroenterology at the University of California, San Francisco, in which I did a whole bunch of different research and got some experience in understanding a bit more about how kids interact with pain and other things in their intestine. And then after finishing that, came back here and took a job. I'm really happy to be here. I like the community in East Brooklyn. It's the kind of folks that I think don't always have access to the same level of care, and I really like to be able to extend that to them. So I am really enjoying my experience here in the year I've been here so far.
Great. So, Dr. Wallick, it's such an honor to have you with us, and clearly you're well trained. You've got amazing experience, and for myself, for my patients, we have been really struggling with the pandemic and dealing with patients across the board, but particularly now, we've been struggling with how to take care of our younger patients. So can you just start us off by letting us know how the pandemic has impacted you, your practice, and the patients that your organization serves?
Yeah, so I've had, I think in my personal practice, a little bit of what we call in medicine a white cloud, which is sort of a lucky streak, which is that I tend to have been in the places that are having some of the least COVID in the country, and then as I move, that next place also starts to have the least COVID in the country.
Yeah.
So I've definitely seen patients with COVID and taken care of them, but I haven't been anywhere that's been having a disaster like what we're seeing in the southeast states of the United States right now. And so I haven't had I wouldn't even say opportunity, the misfortune to be in a place where the system feels like it's near collapse at this point. What I have seen a lot of is sort of the impact of the public health response on kids, the impact of how that has created issues with nutrition, created issues with sort of access to care and loss of follow-up and other things that kind of happen have a higher tendency to occur in patients who are of lower economic means. So if you don't have as much money, you don't have as much access to your doctor,
Right.
or access to grocery stores, you rely on school meals, things like that. There's definitely a lot of complicating factors that we've seen there. But pediatrics is a small field, and social is a small field, and I have colleagues and friends and folks who I've worked with who have been in some of the worst places in the country during all this. And the impact has been pretty substantial, and less because I think COVID is so terribly bad in kids, although I think saying it's the equivalent of the flu is really underestimating the flu almost, because the flu is pretty bad for children, more because they just all seem to get it at the same time because it's so contagious.
Mm-hmm. Right.
So it's been a very interesting almost 2 years.
Yeah.
The impact it's had on our trainees, the impact it's had on other viruses. We're seeing wild variations of when viruses present. Respiratory viruses in the summer are very abnormal. We're seeing a ton of those. We saw more gastrointestinal viruses in the winter because of close quarters. There's just a lot of strange changes, and it impacts a lot of knock-on things that we see in pediatrics.
Yeah. So if you can give us an example, perhaps, for me, taking care of adult patients, I have had a lot of my own patients suffer because of what's going on with their children. Clearly, as a society, we are dealing with the aftermath of what happens with our children, not just with disease, even death in some cases, but the whole impact on social interaction, on their schooling. And, even though we have here documented in New York what's been going on, it's been a tragedy, particularly last year when things were really, really bad. But now we're dealing with a lot of other factors, and that is impacting younger populations much more so than it was last year. So can you kind of opine on that and give us an example of how that's impacted one of your patients?
So I think what's really been so dramatic recently is in the vaccine era is how sort of region by region the pandemic is and sort of the clinical disease and what people face from that, but how the interventions that we have to take need to be occurring on a larger scale. So everyone needs to get their vaccine and we need to all wear masks, we need to all do these things. And it's not because your individual risk or your child's risk is that high. It's because in aggregate, if you take 100,000 kids, and if they all get COVID, 2% of them are going to be in the hospital. That's a lot of kids getting in the hospital, and that's going to overwhelm any pediatric capacity in that area. And then you're going to start to have other things start to get kids. So does your kid have a completely unrelated seizure disorder? Do they have sickle cell anemia? Do they have any number of other diseases? In my specialty, inflammatory bowel disease or liver failure from something else, an autoimmune disease. It's going to be harder for these kids to get care because the system's overwhelmed. It's going to be a challenge to make sure they get access to high level of care, because if everyone's sick with, even if you say it's just the flu, everyone's sick with this at the same time, they all still need to be in the ICU to take care of them. So then we can't do surgeries for cancer. We can't handle it if your child has a seizure. We can't handle it if you have a underlying heart defect. We can't do all these things that we have to do and would normally be doing to help your kids get better.
Yeah.
And so there's this systemic impact, and that has this big knock-on effect all the way down. So for instance, SUNY Downstate during the worst part of the pandemic in New York became a COVID-only hospital. So our pediatric side closed. And that meant for about 4 months, we just didn't have pediatric side. We weren't doing clinic directly. There was some telehealth clinic, but we couldn't weigh you. We couldn't get your labs easily. We couldn't bring you in. We couldn't hospitalize you. And so our patients we had to find ways to get them cared for at other institutions that were still seeing kids.
Yeah.
Or in a lot of cases, if it wasn't that bad, they just didn't get seen. And that was something that was almost impossible to deal with. And that happened on both sides. We both didn't have the availability, but then parents were scared, so they didn't bring their kids in.
Right.
And they're still scared, so some people are still really reluctant to bring their kids in. And when you have a kid who's not growing or who has IBD and needs kind of constant care and constant monitoring, a year, even if they're doing okay, can really be a huge setback. And so we have all these situations where we're playing catch up, and that's for the kids with sort of known health issues, and we know we have to catch up on that. There's all these people who had delayed diagnoses where we could have potentially done better if we caught it earlier. There's sort of systemic effects where absence of school lunches, absence of physical activity have led to worse diets. So we're seeing an increase in obesity that's sort of nationwide, but particularly seems to impact people who make less money. And there's these things are going to have public health impacts all the way down. And I think a lot of people get frustrated, and that's why people want to reopen schools and do these other things. And I do too. Yeah. We absolutely need to, but it's the way to get all these things to get better, to stop doing this to kids, is to get a handle on the pandemic, not to just roll the dice and see what happens if kids get the virus.
Yeah. So to me, what you've just described is crazy. The idea that we would delay care for our children is really, a travesty. I guess I see it from my adult patients because their children are going through this. I see it mostly in mental health because there's such a huge demand of mental health given all the stresses, the trauma, the grief from the pandemic that it's impacted children. Now, I would venture to say if I don't hear about it on a daily basis, I would guess most of our audience hasn't heard it on a daily basis. Would you say, when you say IBD, inflammatory bowel disease, it's such a common thing. We've documented here on this webcast before how cancer has really been delayed because of the pandemic, right? But I don't think many of our viewers have actually heard about how it's delayed care in our childhood population. So can you give us, just sort of a description of what that would look like, in a child?
Sure. So a lot of the diseases we see in pediatrics don't present with a thunderclap. They don't present with someone collapsing and having a heart attack or having something really dramatic that gets an ambulance to rush you to the hospital. They present, analogy I like to use is sort of like forest fires. You don't notice a forest fire when there's a small brush fire. You notice it when the entire, half of California is on fire and the smoke's crossing over and hitting New York. And the same thing happens, especially in GI and gastrointestinal diseases. We see that all the time. So the most common presentation pattern for a lot of these diseases is you just sort of stop gaining weight, and it starts slowly. So you gain weight less fast than you used to, and then you just kind of stop. And then by the time you start losing weight, if you're seeing your pediatrician and getting weighed regularly, they notice that, and that's when you come see a gastroenterologist. But if you're not seeing your pediatrician regularly, and you're not really weighing yourself and you feel okay, maybe tired or like just not that great, but it's the pandemic and everyone feels not that great, you just might not notice. And if you don't see the doctor and you don't have options to see the doctor and no one's checking you for any of these things, it goes longer and longer. And the problem is, a lot like a forest fire, it's a lot easier to put this out if we catch it early.
Yeah, right.
So when
Absolutely.
you find Crohn's disease, which is a type of inflammatory bowel disease, and you find that early and it's not that bad, our medications work better. And we know they work better. We can show this a lot of different ways in a lot of different studies. And that's just one example of it. This comes up in a variety of different conditions. If you're talking about nutritional deficiencies, a minor vitamin D deficiency is not a huge deal for most people. Most people who live in New York are moderately vitamin deficient.
Mm-hmm.
But if you're a child and you have a major vitamin D deficiency, you get rickets. And rickets is a totally different thing.
Yeah.
And that leads to bone malformations, other things like that. Nutritional deficiencies can cause developmental changes, so your kids just don't develop as quickly. And these things are subtle in some ways, in that there's not gonna be a day where you look at your child like, oh, they're sick, something's up. But after 6 months, you might just notice they should have been doing this and they're not. This should have been happening and it isn't.
Right.
And by that point, the change might be fixable, but it might not. And that's
Right.
sort of the big secondary costs that we're seeing. We're going to see a lot of knock-on costs of the pandemic in pediatric health, because there's just, we had to triage and we had to identify these people are actively having respiratory failure. We have to do this, and that has a bunch of secondary effects.
Well, Dr. Wallick, thank you so much for being with us. I've learned so much. I know our audience has. Just personally with my own children, I can see how I've delayed care, frankly, for things that I probably shouldn't have. And so it's totally understandable that we're seeing a lot of disease out there that really has been under the radar. And so it's really important to shine a light on this like you've done for us. And we really appreciate your time being with us. Thank you, Dr. Tom Wallick from SUNY, State University of New York. And thank you all for tuning in.